Hi, I'm Courtney Knudsen, and I'm going to be talking about hearing aids in nursing homes. According to the Hearing Loss Association of America, the third most common physical condition after arthritis and heart disease is a hearing loss. In adults, the most common causes are noise and aging. About 60% of those people about 60% of the people with a hearing loss are either in the workforce or in educational settings. A hearing aid is the most effective therapeutic measure for a hearing loss. Between 70% and 90% of residents in long-term care facilities have a hearing loss, and about 81% of those residents had not received any care. Although some residents have hearing aids, there is little effort to use them in a nursing home environment. Some of the reasons nursing home residents do not wear their hearing aids include poor fit, painful to wear, difficult to use, not functioning properly, and no help was given when needed. Residents who have cognitive impairment in addition to a hearing loss experience more difficulty in a long-term care environment. Hearing loss in residents with Alzheimer's disease are less likely to be treated, which leads to increased episodes of anger, anxiety, and confusion. So therefore, the hearing needs of residents with Alzheimer's should receive close attention that includes regular hearing screenings and regular hearing aid use and maintenance. There are many tips that can be used to help prevent hearing aids from becoming lost or damaged in a nursing home environment. One of these tips include writing the resident's name on the hearing aids in permanent marker so they can be returned if they are lost. Keeping a small plastic case by the bedside provides a place for storing the hearing aids overnight. A cord and clip system that hooks onto the hearing aids on one end and clips to the resident's clothing on the other can prevent the hearing aids from hitting the floor if they fall. And a picture of the cord and clip system is shown at the bottom. And lastly, nursing home staff should ensure that the hearing aids are cleaned, functioning properly, and are being used. A research study that was conducted in Australia argued that an assistive listening device, or an ALD, has an important role in communication for older hearing impaired people and for hearing rehabilitation. Recent estimates indicate that less than 15% of the estimated 26.7 million people aged 50 years or older with clinically significant hearing loss are known to use hearing aids in the United States. ALDs increase the signal-to-noise ratio, which is beneficial in the understanding of speech in noisy environments, and lessens background noise associated with amplification from hearing aids. When a hearing aid cannot be worn, it is recommended that ALD should be considered as an alternative form of amplification. 20 older adults living in a Queensland retirement village and residential hostel complex in Australia participated in this study, and all the participants had a hearing loss and wore hearing aids. Headphones or earbuds were fitted to the participants' heads and ears. The questionnaire was administered by the researcher through the device, and the participants were then asked to rate the assistive listening device. The findings indicated that the participants had high levels of satisfaction with understanding speech and quality when using the device. And ALDs can improve the quality of life of an older person and can be promoted through nursing practice. So in summary, it is important to work with the nursing home staff to ensure that one's family member receives the services they need and in a timely manner. Some nursing homes have policies where they will cover a deductible for a lost or damaged hearing aid. And ensuring that hearing aids are functioning properly and are being used on a regular basis will greatly improve the quality of life of a nursing home resident and improve the overall communication.